Hey guys, welcome back to another MHI Roundtable virtual discussion. Today we have the great pleasure of being joined by Joe Manello, who has served as the CEO of Myos Corp, the parent company of Myos Md. Under his leadership, Myos Corp has significantly expanded its dedication to world-class clinical research, secured 7 US patents, and launched several successful brands. His strategic direction has consistently driven the company to achieve new heights. So without further ado, Joe, welcome to our MHI roundtable discussion. And we're excited to address today the product that we're going to be talking about.
That's great. Happy to be here.
Welcome, Joe.
Thank you.
So to give you guys a little bit of context, this is a new product that we are obsessed with called Myos Md, which he's going to get a little bit into it. So Joe, why don't you tell us a little more about the background of Myos Md, the company, and how it got developed?
Sure. The company was founded by doctors and scientists who believed that muscle health was largely neglected by medical practitioners. How often you go to the doctor's office, they ask you about your weight, they look at your systems, your symptoms, but they rarely discuss your muscle mass. And these doctors and scientists believe that was important. And that's how the company got founded. They worked pretty hard, spent quite a bit of money coming up with the product that is the basis for Myos Md.
That's wonderful. Wonderful. So guys, so you guys get a little bit of context. This is a product we're going to go into more detail, but you know how we're big with essential amino acids to help you build muscle and repair basically all protein functions of your body. Here's a product that reduces the breakdown of proteins. So before we get into all those details, why don't you tell us a little more, Joe, about the health and longevity benefits of Myos Md, specifically in building muscle and reducing muscle mass?
The beauty of Myos Md is that it is both a muscle builder and it reduces or slows down the loss of muscle as you age with injury, if you're losing weight, anything, surgery, anything you do where you have muscle atrophy, you have the best of both worlds here. It has 19 amino acids in it that helps you build muscle, and yet this product also helps reduce muscle atrophy.
That's awesome. I love it. Now, tell us a little more about the science and clinical research to back up the claims behind Myos Md, because they're pretty big and it's 6 studies.
Yes, so our first study was done at the University of Tampa, 19 to 21-year-old males. Our product increased muscle mass and size 3 times versus the placebo group. Everyone had an increase in muscle because they were doing resistance training twice a week. We had another study, a 100-dog study. After surgery, the dogs had recovered quicker, the ones on our product, and had 0 increase in myostatin. Myostatin is something in your body that puts a lid on muscle growth. We also had a study at McMaster University where it was called the leg immobilization study, and that creates muscle atrophy. Again, the people on our product, the product behind Myos Md, had no increase in myostatin. We also did a study on cats with chronic kidney disease. And those cats, chronic kidney disease, cats cannot take in a lot of protein. Humans can't take in a lot of protein. And they lose muscle. The cats on our product, even though they were on a low protein diet, had an increase. 70% of the cats in the study had an increase in lean muscle mass, and it did not affect their renal panel. And the final study was, 2 final studies were with older dogs and humans 60 to 75-year-old. In the dog study, it was geriatric and arthritic dogs. The dogs with taking our product were more mobile and much more active. in the 60 to 75-year-old male and female study at UCal Berkeley, we saw an 18% increase in muscle protein synthesis in 21 days with our product versus the placebo with zero exercise. So that gives you our studies in a nutshell.
That's what, by the way, I have to just testify because my brother knows our dogs are taking this product, and without a shadow of a doubt, we've seen their muscle composition go up, and they're 10, they're almost 11 already, and they're running around like little babies. So I know the product is absolutely working in my dogs, and it seems like this is the product that you can give almost intended for almost any animal that walks on planet Earth.
Yeah, now, for some context, Joe, just because we've been like blasting through this, so just for the listener to have some context, and correct me if I'm wrong when I say this. So we're fascinated by this product when we started researching, and we were introduced to it. So my understanding is the following. So we have a protein in our body called myostatin that we see an increment on, a pretty significant increment as we age, or when we get an injury, or when we are in post-surgery, in a post-surgery situation, right? So we have an increment of myostatin. Now, science doesn't exactly know how or why it happens, and they don't know the syntax, but we do see a correlation between aging and a raise in myostatin. So for some of the people that are listening, look up at the Belgian bull so that you understand how myostatin sort of kind of works. But my understanding is that Myos Md reduces myostatin, it therefore reducing muscle loss and incrementing muscle synthesis. So you started out many years ago doing animal studies, and when you saw the success to that, then you moved on to human studies, and in the human studies you saw an 18 to 22% muscle synthesis success rate without exercise, correct?
Yes, actually our first study was in humans, and then we did dogs and humans.
Oh, wow.
So our first study was in 18 to 21-year-old males. And in that study, we saw 3 pathways in the body that our product improved. The muscle building pathway, myostatin pathway, it reduced it, and it reduced the muscle degradation or your muscle atrophy pathway. So the beauty of this product is you get that benefit. And we were kind of shocked and excited about that. So we have spent a lot of time working and focusing on the muscle loss, muscle degradation, or muscle atrophy piece, because that's the one whether you're trying to build muscle or keep muscle or gain muscle back after illness, surgery, losing weight, having disease, whatever it is, that's the pathway you really want to focus on.
And just to be clear, for those who want to research it, which we encourage, what you'll find is there's a little controversy, because we all know that as we age we lose muscle. Now, we don't know if it's because we're losing muscle that myostatin goes up, or is it that as we age myostatin goes up and then we lose muscle. So we don't exactly know that correlation, if it's the chicken and the egg scenario, but we know that there is a relationship with high myostatin and muscle breakdown.
Right. Correct. But what we know, and the beauty of our product, it works. And what you will find with drugs, you don't always know.
I can testify, Miguel's dogs, the guy has traps, man. So we've been using it for a couple months, and I switched up my training program. I'm doing a lot less weight, and I haven't decreased in size. So my muscle composition has remained excellent. So I love the product. It tastes great. So I know, Miguel, sorry, man, I know you had some questions.
Yeah, let's just move on to the relatable things and how this product, for at least for us, has been very useful. And it gives us a little bit of an upper edge on many other practices, I believe, because nobody's really using this product. And specifically now with, the fad of GLP-1s, which are phenomenal medications for diabetes, obesity, to regulate inflammation in your heart and your kidneys, basically almost every single organ. So I'm seeing that using this supplement along with the GLP-1 like tirzepatide or semaglutide, it's just a no-brainer to prevent any muscle loss, because there is a lot of doctors saying that taking these GLPs and having very fast weight loss decreases your muscle mass. So here's a way of blocking it. Correct?
Yeah.
Correct. Our product, when you lose weight rapidly, your metabolism slows down. If you build up muscle or reverse muscle loss, your metabolism picks up.
Yeah.
And our product is perfect for that. Plus, its caloric content is very low. So you get a tremendous bang for the buck without taking in a lot of calories, which is pretty powerful.
And I love that, I just want to kind of circle back on something that you said earlier about protein, because we educate people a lot on protein, right? The two things that we tell them all the time is like, hey, you don't need protein, what you need is amino acids to make protein. That's number one. Number two, exactly what you said, you can't take a lot of protein because there's a lot of insulinogenic results. I mean, you can't eat that much protein. So the fact that you just said that, and this adds to the fact that we can use amino acids together with this to prevent muscle loss and build muscle without overconsumption of protein, which, by the way, if you eat a lot of protein, it can easily be turned into sugar. Most people don't know that, right? So I think that this is an amazing compound to combine with your essential amino acids to prevent, like you said, muscle loss and build muscle effectively, efficiently, without having a huge insulin spike or some kind of huge caloric intake.
It's like the burger and the fries. Perfect combo.
It's a good combo.
I also see that it could be utilized for patients with kidney issues that can't consume lots of proteins. So this is a way of basically consuming a different product that blocks you from losing muscle. Correct? That seems.
Yes, and again, we did a study in cats with chronic kidney disease, and the reason we looked at cats is chronic kidney disease is very prevalent for older cats, and we wanted to test first and foremost if it affected their renal panel, because if it got into negative territory on the renal panel, then they couldn't take it. The beauty about it is our product was able to increase their lean muscle in 70% of the cats, as I said, and not affect their renal panel. Now, anyone who has a kidney issue, work with your doctor, make sure it doesn't affect your renal panel. But if you can slow down that muscle loss or increase your lean muscle mass with this product, that will be really, really helpful.
Right. And then another one. Sorry, Carlos, what?
No, go ahead. I'm sorry.
And then another one that this product is just beneficial everywhere you look at it. Feels like when we found essential aminos.
Yeah, it does.
So, and again, it's just the perfect combination. We're science, like, again, if you would just see what goes on in my brain, how science works, it's incredible. And these two products, they're just Batman and Robin. So, I do notice as well, I had a meniscus surgery, and it took me it put me out for 5 weeks where I could not walk for 5 weeks. And I tried stepping for the first time on the 6th week. It's been 2 years since that surgery, and I'm on testosterone therapy. I'm on essential amino. I'm on everything you can possibly be on that keeps you optimized. And I'm still recovering the muscle on my left leg. So this also seems like a great product to consume pre and post surgery. Like if you don't want to consume it all the time, you can strategically use it as well if you have a surgery to prevent that muscle decay when you can't walk or move that limb for a certain period of time. That makes sense, right?
It
Joe?
does. And I think it's really important what you said, pre and post.
Right.
What we have found anecdotally and through science is that if you take it, let's say, a month before you're going to get surgery, and then for the next couple of months, a higher dose for those next couple of months, you will have less muscle atrophy. You will be able to recover quicker, and thus you'll be on your way. So 2 years down the road, you won't look at your legs or your arms and say, man, there's such a difference between the two. And there's a fair amount of science about keeping, if you can keep that muscle with that injury or with that, when you have surgery, it really helps recovery.
Right, right. That sounds amazing, man. And again, if any of our patients ever incur an injury and they need surgery, we'll make sure to basically pound our hands on the table about this product.
I've already started sending this stuff out like crazy.
Yeah.
So
So another thing that I do see also for older patients, more like in their 60s, 70s, that have arthritis, joint pain, mobility issues, since you're preventing the muscle from breaking or reducing the breakdown of muscle, let's say you put that patient on a working out protocol and they are consuming proper essential amino acids to build these fibers. But in addition to that, you're reducing the loss of these muscle fibers. It seems like you can build the little muscles around the joint cavities, and wherever you have, a joint socket, a ball and socket joint, that you would actually build those little muscles to improve the mobility and reduce pain at the joint level. It almost seems like that, right?
So just look at it. If you have joint pain, you're not going to be as mobile. If you're not as mobile, you're not moving. Those muscles around that joint will start atrophying. Okay. If you don't use it, you lose it. So if you can build those muscles up with our product, then you will move more. Then you will continue to build muscle. And the beauty of, as I spoke about our study, people built muscle and reduced muscle atrophy even without exercise. So now you're able to move more. You're moving that joint. You're lubricating all that fluid in there. And it becomes just a great effect because you're addressing the muscle. You see tons of joint supplements out in the market, and I'm not saying they're not good. They are, but people neglect the muscle, and you shouldn't.
Yeah.
Well,
now, tell me a little bit about how it's made, what it's made out of.
Yeah, I was gonna add one more to the list, and maybe we can join partnership in this study, because based on everything you just said, for longevity purposes, we do know, I don't want to go deep down this rabbit hole because most people won't understand, but anytime you lift weights, take any like anabolics, growth hormone, protein itself will activate mTOR, which helps you look and perform better, but at the expense of your longevity. You burn both ends of the candles much faster. So what it seems to me is that I can reduce my days of lifting weights because I can retain that muscle mass, focus more on building my cardiovascular VO2 max, reduce the mTOR activation, and elongate longevity. This is geeked out to its maximum, but it seems like, again, if instead of taking essential aminos every day to build protein, sometimes just take a break off of it and focus on maintaining this product or even doubling the dose just to prevent any muscle mass. For people like my brother and I that are extremely active, right? We're working 5 to 6 days a week physically. So yeah, that was the last little nugget that I wanted to add. Now, Carlos, we're going to go into all the details about product and usage. So for the viewers, here's the product. Let me see it. Myos Md. This is a doctor prescribed supplement that we are utilizing in our office now, and it comes in a non-flavored form, in a powder non-flavored, and it's also going to be made in vanilla flavor, which that sounds phenomenal. So one question that most people are going to have, because obviously it's based on egg yolk, so why not just consume eggs and get the similar effects?
It's not close. It's derived, first of all, from fertile egg yolk in a process that we spent quite a bit of money on researching and developing. So what you're getting is a really, really a product that has just these incredible bioavailability and really works on, as I said, not only muscle building, but muscle atrophy. It's completely different. And I'm not against egg yolk. Eggs are a great protein source and a great food. Our product is completely different because of the way it's manufactured and because of where it comes from. But it's one ingredient. You can look at a lot of products out there. There's so many different ingredients. This is one.
Right.
Yeah, I know. Listen, I love it. For the viewers, I put it straight in my mouth, unflavored. It actually tastes like, I want to say like unsalted eggs, cooked eggs, if you will. But you know, I'm kind of a freak. I don't mind the taste, you know, bad taste, but it doesn't taste bad, which is a good thing.
It's very neutral. Yeah, as he
Yeah,
said,
it's very neutral.
So
Great in smoothies. Great in smoothies.
Listen,
Smoothies.
I come back from the gym and that's what I break my fast with, and then I do.
That's how I take it, but I'm used to it. I recommend it in smoothies,
Yeah.
almond milk.
I'll tell you what, I'll tell you why I don't put it in my smoothies, because I don't want to miss a grain of it. And it's so
Yeah, no, but you don't.
Yeah, it's a little bit granular, so sometimes you gotta like blend it for a
Right.
while for it to, you know, so I just put it in my mouth and
It's granular for a reason. Our process creates that effect. It's not this,
yeah, it's not
powder that,
Yeah.
Looks like paste.
So
Yeah,
wait, actually, I blend it in my smoothie because then for most people that are not going to do what we do, which is savages, I basically scoop the rest of my blender, I mean, of my smoothie cup. I'll scoop it out to make sure there's nothing left. So
Yeah.
maybe I left a 0.0 milligram behind.
I see it like glued onto the sides and I freak out. I'm like, no, I'm just gonna take it in my mouth.
Now, if you blend it, it doesn't damage it because, as Carlos said, it's granular. It won't damage it, right?
No, because by the state it's in, by the time you get it, it is really in a really powerful state. That will not hurt it.
Okay.
So, I mean, and, you know, my only thing, again, guys, for anybody listening, you know, we always spend a lot of time in educating people about protein, how that really works. You know, a lot of people think that they're just going to eat animal flesh and it's going to turn into muscle. It really does not work like that. So if you have any questions, obviously call us, because this is an area. I'm not finishing. I'm not finishing.
Okay, I'm just making sure.
I'm not finishing. I just, you know, I want people that are watching this to call us so they can learn more about how protein actually works, how to build muscle. And the fact that we now have this product available in conjunction to the other things that we do, I think is a slam dunk for really having the ability to provide something to the people that actually has science behind it, that produces result without having some kind of pharmaceutical intervention, right? Because a lot of our guys are on testosterone, and we know that produces muscle in and of itself, but a lot of guys don't want to do that, or they're just like on some peptide. But introducing this product to the body so that you downregulate the effects that kills muscle breakdown, especially if you're 40 and above, I mean, it's a no-brainer. Now, one question that I did have, because look, there is, one of the things that we talk a lot about, Joe, is the fact that we've lost so many nutrients in the soil. So like food is no longer enough, period, end of story. There's no discussion there. So that's why we do a lot of these supplements. And our kids, I have nephews and nieces that are very young, and I just wish that I knew what I knew now when I was 17 years old, or even less. So is this product recommended like for toddlers or maybe teenagers or the young population who are not getting enough from their food? I mean, we have an obesity crisis in this country because of what you said, calories and calories and calories to kind of give our bodies nutrients. So is this a product that's recommended for, and I know there's maybe some red tape because it's just politics, but what do you see in the younger generation?
I know we have teenagers who take it, athletes. Now, I'm not going to make a statement about what's good for a toddler or not. The beauty about this product is it is a nutritional fact panel, because it is essentially a food. Even though it's a supplement, it is supplementing food. The beauty about the product also, it is nutrient dense. You get 19 amino acids, 9 essential amino acids. So I am a big fan of foods that are dense and have a big bang for their buck. And this is one. But I can't talk
Yeah,
about
no,
giving
no,
those
listen,
timers.
I'll answer
got
it. It's pretty simple. We've tuned it all the time. Since 1945 to today, we've lost more than 50% of our reproductive markers, which that entails lower testosterone levels. We've seen 16-year-old boys coming to our clinic that get tested that have the testosterone of an 80-year-old. If you don't have testosterone, you can't build nor preserve muscle mass. Period. End of story. So even for young teenagers who are also already suffering from hypogonadism or from iron overload that's scarring their pituitary gland, and they can't produce testosterone, which is secondary, it's iron-induced secondary hypogonadism. This is a product that literally for all ranges of ages, for injuries, for animals. I can testify again that my animals have improved from this. So it's a phenomenal product. I think we killed that question. Now, I do want to ask, are there any side effects?
If you're allergic to eggs, yes. Other than that, no.
And then last question is, at what point do I stop losing the effects of if I stop taking the product? I mean, does it, I start losing muscle right away, or does it take a while, or any data?
Ask yourself, if you stop taking protein or you stop taking something else, what would happen? Eventually, and it might not be day 1 or week 1 or week 2. Don't stop eating properly. Don't have a bad diet. So that's the only thing I can say. It's not as if
I'll actually answer that
even
even better for you, Joe. Basically, the reason why I asked that, you have fat-soluble vitamins. Those can take, if you have high levels, it can take over a month for them to drop back to baseline. This is not a fat-soluble vitamin. Therefore, if you stop taking it, you will immediately start to lose its effects, just like how we tell people to take essential aminos.
Yeah.
And, oh yeah, one last question. This one is outside the script. All those books back there, have you read every single book back there?
No. My wife puts them, so I seem like people think I'm a really smart CEO.
Yeah. Damn, this guy's read a lot of books. I mean, my little shelf makes me look embarrassing with your.
Sounds like
I have all my children's pictures over there. They used to be behind me. Now my wife is an interior designer, so she keeps changing things. But I do want to tell everyone that go to Myos Md if you want to read about the studies. They're all peer-reviewed, except the chronic kidney disease, because that's our most recent study. It will be published shortly. But they're all double-blind, they're peer-reviewed. We take a lot of pride in our science, and it's very unusual for a company our size to continue to do science.
And to be clear, when you hear the word double-blind, peer-reviewed, these are like gold standard of studies, right? Like you're not talking a single study. This is, again, when you hear the word double-blind, peer-reviewed, those are solid studies. So great product.
Amazing stuff, Joe. Listen, we love it. Thank you for your contribution. Sounds like your wife is a great CEO. And, for anybody watching, I mean, we vouch for Joe's product. We tried it not only on our animals, but on ourselves. If you're interested, look up, myostatin inhibition. Please go to their website if you want to see the studies. This is one of the very few supplements out there in the industry that actually has human trials. So very, very important. And again, guys, this is food. So if you have any questions, issues, concerns, obviously give us a call and we'll point you in the right direction. Until then, Joe, thank you so much for joining us.
Well, thank you, guys. It's my pleasure. Any questions?
Look, I already see my muscles getting bigger. Look at those, they got bigger, baby.
I have them, but nothing like that.
You guys gotta double up your dose.
All right, guys, have a great day, and thank you for tuning in. Take care.
That's great. Thank you, guys. Be well.